Okay, so my group, me, Sierra, Kamaya, Naya, and Maris, we did the impact of mass incarceration on incarcerated women in general, not specifically on Black women. Okay, first, is like the statistics. So the rate of growth for imprisonment has been twice as high as that of men since 1980. Today there are 1.2 million women under the supervision of the criminal justice system, and women make up 7% of the overall US prison population. Between 1990 and 2000, that number has risen 108%. And then women's needs differ than that of men. That goes for prenatal, medical, and hygiene. So the background, the rate of imprisonment of African American women was over 1.7 times the rate of imprisonment for white women. A lot of them lack literacy and a diploma. More than 60% of women in state prisons have a child under the age of 18, and an incarcerated woman's child is 5 times more likely to enter the foster care system. Over 1.5 million children have a parent in prison, and more than 8.3 million children have a parent under correctional supervision. And about half of the women in prison have suffered physical or sexual abuse in the past. And then the reasons for women incarceration. Women in state prisons are more likely than that of men to be incarcerated for a drug or property offense. The ratio is 26% to 13%. The proportion of imprisoned women convicted of a drug offense has increased from 12% in 1986 to 26% in 2018. Drugs has caused a significant increase in the number of women incarcerated. 40% of criminal convictions leading to incarceration of women in 2000 were for drug-related crimes. 34% were for other nonviolent crimes like burglary, larceny, and fraud. 18% of women were incarcerated for violent conduct, and 7% were for public order offenses.
Okay, so my section, I'm going to talk about women's health while incarcerated. So, overall, women's health is something that needs to be addressed and examined more closely. Women that are incarcerated are more likely to have issues with various areas, such as gynecological issues, breast and cervical cancers, STIs, dietary issues, aging, chronic conditions, and much more. So, I'm just going to talk about gynecological for a second. So, research has been has documented that incarcerated women tend to have higher rates of gynecological issues and conditions such as um, vaginal discharge issues, menstrual bleeding, um, than non-incarcerated women, and then they have limited access to gynecological care. And then in another study, it showed that 40% of incarcerated women had abnormal menstrual bleeding, and that majority of incarcerated women are young and therefore still menstruating. So, breast and cervical cancer, the rates of breast and cervical cancer are higher among incarcerated women and are likely related to the fact that they don't really have access to screenings as they should. And correctional facilities don't routinely perform pap smears upon intake unless the women is due for one based on previous screenings. And then STIs, it has been reported that women in incarceration while in custody, hold on, there's a higher rate of STIs and non-sexually transmitted bacterial issues. And pretty much what I learned was that women are 33% more likely to be tested positive for an STI upon admission, and that they don't routinely do STI checks or have any actual care for women with STIs. So, some other areas. that women that are incarcerated have issues with are family planning. There is limited access to contraception, or in some cases, in certain prisons, they might have come in with a baby or be pregnant when they come in, but sometimes they're not aware and their correctional facility doesn't provide care for that. And then the same with postpartum pregnancy and parenting. Correctional facilities are required to provide pregnancy and postpartum care in accordance with the national guidelines, but these guidelines are not necessarily enforced. So the correctional facility is required to provide support with breastfeeding their infants, and they are supposed to be allowed to maintain access with their children, and they're supposed to receive postpartum treatments, but most facilities are not, they are not enforcing these laws. So aging and chronic disease, most prisons fail to recognize and prepare for special physical and social preventive health needs. So when women go through menopause, they don't recognize those challenges, or in some cases, things like hypertension, hepatitis, and cancer in women are not necessarily being treated, and also things like dementia are not being recognized as well. And then in nutrition and diet, the correctional institutions are supposed to ensure a healthy diet consistent with federal and dietary nutrition guidelines, but that is not being enforced, and obesity is more common among the incarcerated.
Okay, now we're going to address the mental health of incarcerated women. In a survey by the Bureau of Statistics released in 2017 that was taken from 2011 to 2012, 2/3 of incarcerated women in America report having mental health issues. Women were asked if they were previously psychologically diagnosed by a professional with a disorder, such as depression, bipolar disorder, schizophrenia, post-traumatic stress disorder, anxiety, and etc. They were also asked about their moods and emotion within the 30 days of taking the survey. 32.3% of women experienced stress within the past 30 days, and 67.9% of women were previously diagnosed. So as we're going to go to the comparison, despite women being 7% of the prison population as of 2017, 66% report having a mental disorder. This is almost 2 times the percentage of men. And then a comparison with white women or non-women of color, women of color are overrepresented among their female inmates, and Black women in particular are 2 times as likely to be incarcerated than a white woman. In general, more than half of white incarcerated individuals report being previously diagnosed and are more likely to receive mental health services rather than Black and Hispanic individuals. This rate also applies to women in these racial groups as well. So the difference also shows racial bias, according to Dr. Robert Cohen of the New York Board of Correction. Minority communities often aren't aware that they're experiencing mental illness, and those who are experiencing mental illness weren't able to access help if they needed it. So continuing on, prior to incarceration, what are some of the factors prior to prison that affect the mental health and behavior of incarcerated women? There are often various serious and social and or psychological forces that underlie female offending. This includes higher than average rates of lifetime exposure to cumulative trauma, physical and sexual victimization, untreated mental illness, substance use that is used to manage stress, and behavioral choices that are in conjunction with large, transparent economic disparities. So many women who were arrested for running away, living on streets, engaging in sex work and property crimes, many of those women were fleeing interpersonal violence. Women report higher rates of incidences containing physical and sexual abuse, as well as histories of emotional and behavioral disorders, mostly due to trauma and victimization. So, what about during and after incarceration? What are some of the factors while in prison that affect the mental health of incarcerated women? And what about after release? During incarceration, women bring their trauma into prison as well as report higher rates of physical and sexual victimization. For anybody who watched College Behind Bars, one of the female prisoners named Shanta, before she had gone into prison, she was abused by her boyfriend, and she had a child as well. And he would threaten her, the kid, and the family. And she ended up coming into prison because she got framed because he killed her child because he abused her so much. So that trauma was brought into prison with her. And thankfully for her, she was able to use education as a way out, as a way to deal with the trauma and the victimization that she had went through. So incarcerated women are at a greater risk of destabilization and distress due to harsh rules and regulations of correctional facilities, the climate of violence and dysfunction, and the pre-existing vulnerability of inmates. Because inmates that can withstand, or well, they'll go through harsh punishments, and staff violence against women is a significant challenge that they'll go through. And surprisingly, a lot more violent acts are actually perpetrated by fellow inmates, but a good amount is done by correctional officers. Substance abuse and mental health treatment are scarce in prison, if non-existent. So incarcerated women, correctional staff, and Department of Corrections stakeholders have said that mental health services are limited in prison because of a lack of staff expertise around sexual assault and infrequent chances for women to even go and meet the mental health staff. Women in prison, and basically anybody in prison, they have to withgo a routine done by the prison. And if within this time they can't find the time of the day to go and get themselves checked out mentally, then it just won't happen. Even after release, those who haven't received assistance that they needed in incarceration, for those who haven't received it, their rates of relapse are going to be very high.
Okay, so now I'm going to talk a little bit about the living conditions of women in prison. So starting off, prison makes it more difficult for women and mothers to maintain relationships with family due to a combination of issues posed by the child welfare system and correctional facilities. So for example, correctional facilities pose create a lot of problems with visitation, but child welfare will actually pretty much block children from seeing their mothers. And as a result, the mental health of mothers in prison is jeopardized in addition to all of the other factors that negatively impact their mental health there. Studies show that over 60% of female inmates suffered from symptoms of drug abuse. Around 30% were dependent upon alcohol, and like around a third had symptoms of PTSD as well. But despite these numbers, there's a lack of rehab for substance abuse in jail or any resources to help or aid with mental health at all, really. And prisons also tend to over-medicate women instead of offering better treatment or treatment that women actually need. In prison, women are disproportionately targeted for disciplinary action, and as well, studies show that women substance abusers are also more prone to issues with mental illness than men. Children are traumatized due to being separated from a parent and also from witnessing the arrest itself. And as I said before, children taken in by welfare are in many cases barred from seeing their mothers at all. So it's not a matter of like them not being able to see their mothers for weeks or months. It's actually like a matter of years, if at all. So 4 to 9% of women come to prison pregnant, and women that give birth in prisons are not allowed to spend much time with their child. So after giving birth, they are actually pretty much taken from their child. And there's a lack of physical and mental care both before and after pregnancy. And there's a lack of education revolving around childbirth and parenting. And as mentioned before, sexual abuse in prison is prominent, but also extremely overlooked.
All right, so now I'm going to talk about incarcerated women of education, pre and post incarceration. So starting from the school system, as young Black girls go to school daily, there are somewhat racially biased rules set in place to stop them from continuing their education that would egg them on or start the foundation for them to be incarcerated in years as if they were young adults or older. And this can be from as they would get suspended for unnecessary things like fights. Well, there are other solutions that could be put in place for when people do violate school rules. It does not always have to result in with suspension. Suspension just leads to more time out of school and less learning in the classroom. And you never know a person's struggles outside of school, and school could be their only safe place. And that learning could be disrupted by the racially biased rules that happen in the school classrooms. Now, African American girls are 10 times more likely to be suspended rather than their Caucasian counterpart or classmate, due to the fact that there could be such thing as a student could be complaining about their hair or little small things that they do. And I know that growing up, many people have experienced that they've seen more Caucasian teachers than they have seen African American teachers. And personally, I can relate that I've had a better relationship with my African American teachers than my Caucasian professors. And that does make a huge significant difference when it comes to learning in the classroom. Next slide. Also, when Black women are incarcerated, most of them never graduated high school, or they're in the middle of getting their college degree, but they never finished. And now they are faced with the fact that they either need a GED or they just need a college degree, because when you exit the prison system, it is hard to get a job or even basic life skills as you don't have a GED or a college degree. And so now they're just left to face with either being homeless, jobless, or just struggling economically. The prison system works in a way where they also can try to block women getting education in the system, such as a couple of years ago, a Pell Grant was passed where they could no longer afford to keep schools open in the prison system for women to get an education.
These are references, and that's all.